Hello, this is KSQD Santa Cruz and KSQT Prunedale. You are listening to Talk of the Bay. I'm your host, PK Haddis. For almost 50 years, Hospice of Santa Cruz County has provided end-of-life care to patients and their families throughout the Central Coast region. That work and its broad reach throughout the community was publicly honored last year by the Santa Cruz Area Chamber of Commerce, which awarded the nonprofit its 2025 Organization of the Year honors at its annual gala. As the Chamber's executive director, Kristen Brown, put it to the Sentinel, quote, "For decades, Hospice of Santa Cruz County has walked alongside local families during some of life's most difficult moments, offering care, comfort, and connection with extraordinary compassion. Their work reaches far beyond end-of-life care, supporting children, caregivers, loved ones, and those experiencing grief in ways that are deeply personal and profoundly meaningful," end quote. To tell us more about how this treasured local organization has managed to thrive for nearly 5 decades, as well as what it must do to continue its work for 50 more years, we're fortunate to be joined in studio by Hospice of Santa Cruz County CEO Cathy Conway. Cathy, thanks so much for coming on to Talk of the Bay.
Thanks, PK. Really nice to be here with you.
Okay, so first things first, why don't you... Well, congratulations on the award. I know it's been a few months now. It still must feel good to see your work honored in that way. For those listeners out there who may not be aware, could you just give us an introduction to hospice? Well, hospice care generally, and Hospice of Santa Cruz County. Tell us about the work that you do.
I'd be happy to. So I kind of thought that was going to be a question that you had, and I took a little different approach to it. I speak about hospice all the time, but I decided to do a little Google search and see what Google says about it. And this is what Google says. Hospice is specialized medical and supportive care for individuals with a terminal illness who are expected to live 6 months or less. And that seems pretty
technically correct,
technically on to me. Mm-hmm. But gosh, if you ask a family about what hospice is, I think they'd give you a different answer. And I think they would say it's a lifeline. And so many times when somebody we love is seriously ill, that person and the person surrounding them have been going through different treatments and doing everything they can to make their loved one comfortable. And often when we see people, they're kind of at their wits' end, right? And I think when I say hospice is a lifeline, we often hear families say, oh my gosh, if we realized how much support you were going to provide, we would have called earlier. And so a lot of the work that we do in the community is helping raise awareness of how we can support so people can make the decision earlier. And, you know, sometimes people, when they think of hospice, they think it's giving up hope. And I really think of it as redirecting what we're hoping for. We're no longer hoping for a cure. We're not at that place in somebody's life. But there are so many things that people still hope for in their last months of life. And if we can help somebody feel well enough to see their child get married, or see a grandchild born, or take that last trip that they want to take, or, you know, have a quality of life at the end of their life because they're comfortable and they're no longer feeling the pain and symptoms of their illness, that can be really fulfilling, life-fulfilling at the end of life. So it's really looking differently at what's important to you at this stage of your life.
And that, what your answer also makes me think that as much as it is for the patient themselves, it's also for their families, right? Because I understand grief counseling, grief, of course, is a huge component for families of those who have passed on. And that's also been sort of folded into the work that you all do. No?
Absolutely. So we are caring for people who are seriously ill in our community who might not be ready for hospice yet. Hospice is a very specific criteria that it's a benefit of Medicare. And so Medicare says that somebody must be in the last 6 months of their life if their disease continues in its natural course. Nobody's all that great about predicting what 6 months looks like, and some people live much longer than that and can still receive hospice care. But we care for people before they're ready for hospice or eligible. We care for them while they're on hospice, and then we care for the family for up to 13 months after their loved one died. And 13 months is a kind of funny number, right? Mm-hmm. But 13 months gets that person through all the firsts without their special person, right? Mm-hmm. Their anniversary of the death, perhaps their wedding anniversary, the birthdays, the holidays. And so we want to support people through that year of firsts.
And I wanted to hold on that point you mentioned, which is that hospice care is a Medicare benefit, correct? So
That's right.
Most, if not all, of the services you provide are in fact free. Is that right?
Yeah, that the Medicare pays for the services. Most private insurances also pay for the hospice services as well. Mm-hmm. And so people receiving the care are not receiving a bill from us. We bill Medicare, and Medicare reimburses us for that service.
And one other distinction I wanted to ask you about, which is Hospice of Santa Cruz County is a nonprofit hospice, correct? And there are some that are for profit. So what's the difference between those two, or how can you tell from a patient perspective?
Yeah, I think so. The whole hospice industry started about 50 years ago. We're 48 years old,
right.
This Hospice of Santa Cruz County.
On the cutting edge of this. Of
One of the first. There were a whole bunch that started right around that time, mm-hmm. right? And so we are community-based. And what I mean by that is how we even started. One of the founders, there are a few founders of Hospice of Santa Cruz County. One of the founders is still quite involved with our organization, and I had lunch with her recently, and we recalled the story of this woman being a nurse and being on the playground with her little kids and her friends' little kids, talking about another friend whose husband was dying and was in the hospital. And these two women were talking and saying, gosh, I think we could do this. I think we could provide care for this man so he could die at home, which is what he wanted. Hmm. And that was the first patient, and that was 48 years ago. And so, that we know this person who started the organization right there tells you a little bit of a difference between a nonprofit or an organization like ours and a for-profit corporate organization. We are neighbors caring for neighbors. Often we know the people that we're caring for. The people who provide the care in the community live in the community. And we raise funds from our community to support the programs that aren't covered by Medicare, that for us are the difference between good care, which Medicare covers, and the exceptional care that we think our community deserves. Mm-hmm. And so another difference between a for-profit and a nonprofit. So when hospice started, they were all nonprofits. And now about 75% of the hospices across the country are for-profit. And so there's been this real shift, right? But one of the differences, there was a study that came out a few years ago from an independent research group that looked at the difference between for-profit and nonprofit hospices. And nonprofit hospices provide more nursing visits. They provide more social services visits. And just the care that we're providing is a lot more than you might get with a for-profit hospice. So, people have choices, even in our community, of for-profit hospices and nonprofit hospices. And that's why we think it's important that people ask for our hospice, Hospice of Santa Cruz County, by name, because you do get a choice in what hospice you want to use. And we want to make sure that people get the care that they are hoping to get.
That's such a lovely origin story, and one that I hadn't heard before. I'm so glad you shared it, because I do think it gets to the root of what hospice as a concept does, but also what Hospice of Santa Cruz County as an organization does. And when you think about 50 years, I think that story kind of says a lot about how you've made it this far. And I do want to talk about how you think you can make it another 50, because Lord knows there's plenty of challenges out there.
Yeah.
Before we get to that side of things, one question I wanted to ask, as well as like misconceptions. Are there common misconceptions that come up in your work? Because I feel like because the subject and the patients you're working with are in such a difficult period of their lives, as are their families, as people are wondering what hospice is, even as they're approaching you to learn more, I wonder if there's misconceptions that would be good to kind of share here broadly while we have a microphone.
Yeah. One of them is one I touched at the beginning, that people feel like they're giving up hope, right? Or they're giving up on their loved one if they're choosing this. And really, I think I touched on that, but really just looking at defining hope differently. What's important to you in the amount of time you have left? What are the things that you want to do? And those things aren't usually, I need to still do this, but what relationships do I want to mend? What time do I want to spend with the people that matter to me? However I define family, right? People define family very different ways. So really redefining what hope means. I think another misconception is people think that hospice is a place that you go to. And in our community, we care for people in their homes, wherever they consider home. So that might be your residential private home that you live in. But many of our patients live in facilities, like nursing facilities or residential care facilities for the elderly. And so wherever somebody considers home, that's where we're going to provide the care.
I see you thinking. I see the wheels turning.
Yeah, I'm thinking what other misconceptions. I remember a person that I met with after her husband died, and I found this so interesting. She was the person. Her husband was fairly young. They, in his late 40s, and so she thought he was going to go to some place, and she didn't want to send him to some place, right? And then she realized we were going to care for him in their home. The other thing that she said that always stuck with me, she said, I never realized how much paperwork was involved when somebody's really sick. And she said, that was not her specialty, to deal with paperwork or to fill out forms, whether they were insurance forms, whatever, his health care and the forms that were involved in that, and the leave that he was taking from his job and all these things. And the hospice team came in, and the social workers did that work for her. They said, give this to me. Let me help you with this. And so for her, that was just such a lifesaver. That's one of those things that they were afraid to call, but once they called, they got all the support, and it made such a difference.
Mm-hmm. Tell me about some of the challenges that make the work that you and your colleagues do difficult, or at least the difficulties surrounding the work that you do.
Yeah. And
because I'm thinking now about the healthcare industry, and I'm not sure if you consider the work of hospice to be directly in that or beside it, but in any case, I think of this as a difficult time for the healthcare industry in our country for so many different reasons. And I have to imagine that has impacted you and your teams. So tell me a bit about what's on your mind right now.
And we do consider ourselves part of healthcare.
Mm-hmm.
We're the difference between our care and other parts of healthcare is we look at the patient and the family as the center of the care. Mm-hmm. And so not only are we caring for that patient, but we're caring for the family, however that person considers, whoever they consider family. And so we've got physicians and nurses. We've got a whole medical team that provide that care, but we also have social workers and spiritual care coordinators and volunteers who are part of that, and hospice aides who come in and do the bathing and personal grooming of a patient. And so it's this whole team that comes around. And so while it is, while it is medical care, it's also emotional and spiritual care. Mm-hmm. But we surely think of ourselves as part of the whole medical system.
I'm glad I kind of asked that question indirectly, because I think it was helpful to see just the broad spectrum and continuum of the services that are provided through hospice.
Yeah, I think you're absolutely right. The industry is changing. The medical industry is changing. Medicare is certainly changing. There's changes all around us. I think the interesting thing, when I mentioned that hospice is a Medicare benefit, the Medicare benefit came into effect in 1978, and the actual benefit itself has not changed since that time. Think about how many changes have been in healthcare and just in our world around us in that time.
How about the last 6 months or
exactly, right? But also diseases have changed. Disease trajectories have changed, right? And so that the hospice Medicare benefit has not changed, we have not kept up with the time. When I mentioned that when somebody is seriously ill and is hospice appropriate, they must have 6 months or less to live, a prognosis of 6 months or less. That is an arbitrary number that was that somebody came up with. And actually, we know the people who came up with that. They're still in the industry, and they talk about how that was a number that was kind of picked out of a hat. First, they tried for 9 months, and it didn't save enough money. And so they got it down to 6 months, and then they got the approval to have the Medicare benefit. People live a lot longer these days and need more help. And hospice can't care for them unless they're in that 6-month window, because we will not get paid to do that care. And so we're working with congressional leaders to look at how we can expand that 6-month window, right, to provide care before they're ready for hospice, like palliative care, like we're talking about. When somebody is on palliative care, the team is working with them around symptom management, around pain, around psychosocial issues. But there's no reimbursement from the federal government for that. So that's a challenge. We want to provide that care, but there's no reimbursement stream. And so organizations that we're part of are national one of our national organizations that works specifically with nonprofit hospices is working with Congress to see how we might change the payment structure so that we can care for patients all along the way, because hospice still saves so much money. We're able to care for people at home. We're able to manage their pain and symptoms so they're not going to the hospital, and that saves the system money. It relieves the burdens. It's where people want the care. And so if we can look at different ways to reimagine hospice, and that work's being done right now, that could be better for the whole system.
Okay, so you're talking about some work. This would be at the federal level.
That's at the federal level.
Yes. I see.
Mm-hmm.
Okay, and as you mentioned, no changes were made to the sort of structure or the reimbursement structure for decades since 1978, I think you said, right? But in recent years, that recipe has changed, or it is in process of changing. Do I have that right? Which has caused you to make some pivots as an organization, or am I misunderstanding this in some way? No,
I think because you and I have spoken before, right. The thing that's changed is the amount that we're reimbursed, right? The federal government has tried to keep pace with that, but the main structure of hospice and the eligibility and the payment structure hasn't changed.
Okay.
But the federal government has tried to keep up with costs. There is a gap between what we're reimbursed and what it actually costs to provide care, and that's where hospices throughout the country are looking at what else they can do to make sure they're sustainable and can be here for the next 50 years.
And so your organization has come up with a creative solution, in addition to a few others, to form sort of a coalition called Chapters Health West Partnership. Could you tell us, I know it's probably a very complicated situation, far, we don't have enough time for you to cover it all, but tell us a bit about that partnership, what it'll do.
I'd be happy to.
Yeah.
So Chapters Health System is a health system that's primarily based in hospice. They're originally on the East Coast and nonprofit hospice care and seriously ill care management. A number of hospices out here in the West, we all know each other, right, who are in the industry. We started to have conversations some years ago about how we could work more closely together to be able to serve our communities. Of course, when you think of a healthcare organization, and hospice is a healthcare organization, we all need a compliance department. We all need a number of back office things like billing and different departments to run well. And you need that whether you're a small hospice, a medium hospice, or a large hospice. But when you're a smaller hospice and you have to have all these departments, it can be a burden for your organization and doesn't allow you to put your time and energy into the patients and families you want to serve. And so we started to look at other hospices who would be interested in combining those services. And so now 5 hospices have come together in the Western region to partner and to affiliate with Chapters Health System back east and to form Chapters Health West. Mm-hmm. And so we're the first organizations to come under this Western region umbrella. And what that allows us to do is utilize some of these services and cost-saving structures so we can really spend our time and energy in serving our communities.
Mm-hmm. Okay, and there's one more subject I want to ask you about that's has to do with kind of hospice being in the news lately, and some listeners may have some questions about, which is there was news made, I don't know, I think it's a couple months ago now, where the Trump administration put a 6-month moratorium on new Medicare hospice enrollments nationwide. Tell me if that impacts your or our local hospice here in Santa Cruz County, and if so, positive, negatives. Tell us about how that impacted you.
Sure. So the moratorium means that new hospice providers can't open up shops in our local community, in communities throughout the country. The reason this was put into place is because there has been fraud and abuse within this industry. Mm-hmm. We see it a lot in California, and especially in Southern California, where there were people who were opening up hospice organizations, hospice companies. They were bringing patients onto service who perhaps didn't even know they were on service. They weren't eligible. The fraud often deals with keeping somebody on hospice service who is either ineligible or even perhaps no longer alive, and they're just billing the Medicare system, right? So in their effort, in the federal government's effort to clamp down on this and really weed out the poor hospice providers or the fraudulent hospice providers, they put this moratorium. So the moratorium does not impact any already functioning hospice, right? So we have not seen any issue around that. There have been other regulations in order to kind of clamp down on this fraud and abuse. There is more scrutiny that is coming into the hospice arena, and we are impacted by that. And we're hoping that what the federal government will do is look at the data, the quality data they have already. Hospices are required to report data on the quality of care that they provide. And we're very proud to be one of the highest quality rated hospices in this area. And so we're hoping that the federal government will use that data that they have to weed out the poor performers and ensure that they're putting the scrutiny on them so that they can improve the quality that they're doing instead of focusing on the high quality hospices and burdening the high quality hospices with more scrutiny.
Okay, well, thank you for that explanation. I know it's both of those two past questions were complicated subjects, and I appreciate the thorough and clear breakdown in not a limited time frame.
I guess one thing I'd add, PK, is that the thing I get concerned about when you hear things like that in the news, that people are going to not understand that there are really high quality hospices in our area, and perhaps not call, right? And so, I want to assure everyone, we've been around for 48 years. We provide high quality. We've got the data that shows that. And people, when they're choosing hospice, can go on the Medicare.gov website. Even if you just do a search of hospice care compare, you can put in the city you live in, and you can see the hospices that serve that community, and you can see their star ratings. So we really want people to be educated consumers, like they are in all other areas, to be educated consumers in hospice as well.
We've got just a minute or two left here, but to close, I think this would be a nice note to close on. And I wanted to revisit a story you've actually told me before in our previous connections. And just to prompt you here, you were describing to me how you don't want to get your work often involves being behind a computer, looking at spreadsheets as the sort of executive role that you have, but you like to get out and about as much as you can. I think you said at least once a month with some of the teams that are actually visiting patients.
Yeah.
I don't know if you know which story I'm leading to here, but going on tours around communities, I think is what you said. And you mentioned that one recent tour kind of impacted you. Do you know which one I'm talking about?
I think I do. I also have another one that impacted me.
Well, you could go with either one.
Sure. But, I think this one, I went out with one of our nurses just last week, and I drove with him to a patient's home. And in that, I learned not only is he a nurse, but his father was a nurse, his mother is a nurse, his brother is a nurse, and he has nurses throughout his family.
Oh my gosh, wow.
And I never knew this about this nurse. And then to go into the home with him and actually be able to see that level of care that he provides and how well he communicated with this family, it was just so beautiful to see. And I was just so proud of him that when I was downstairs talking with the patient's wife while he was doing some personal care with him, I was able to say, she said, we really like having this nurse with us. And I was able to say, yeah, I just found out about his family. And I started to tell him all the people who were nurses in his family, and just somebody who's that committed to their craft. And I feel like we find that all the time. And so the little story that I had told you was going out with a nurse that I met her at her home. Our first visit was at the end of her road at a patient's home. The next one was right up the road, and the next one was a few blocks over. And I realized that when I say, we are caring for our neighbors, and it's something I like to say, this was proof to me that we truly are caring for our neighbors, and how beautiful that is to ensure that the community we all care for or care about so much is well cared for throughout their life and at the end of life.
Great. Well, thank you for that 2-for-1 story request. I think they were both moving, and it goes to show why this your organization has remained for 48 years and why it's so vital to so many here in Santa Cruz County. So Cathy Conway, CEO of Hospice of Santa Cruz County, I just want to thank you for coming on Talk of the Bay.
Thanks so much for having me.